All right, we're waiting for Dr. Heinzelmann to give us a phone call. We'll be with him in just a moment. I got a shoulder. I got a knee.
Most people do.
It's been a thing. Well, I got two of each of them, but one of each of them is giving me a little issue these days. It's probably I probably shouldn't have, and this was about a year ago. I bought one of these baseball return nets. You know, you throw it, it bounces right back to you.
Yeah,
I might have overdone it. Just thinking I might have, been getting ready to pitch in the World Series or something like that.
You never know when they're going to call your number.
Well, and then the knee thing happened. It just took a weird step, and it's been like 4 months. It's funny, coincides with the day that you joined the show.
Oh, I'm sorry. Well, at least my knee and shoulder injuries happen like, a real man gets hurt in sports. So I didn't just step wrong.
So we sound like a couple of guys that are perfect to go visit Dr. Heinzelmann any minute now. It's Dr. Andrew Heinzelmann joining us now, orthopedic surgeon at Ozark Orthopaedics, specializes in arthroscopic surgery of the shoulder and knee, reconstructive shoulder surgery, and sports medicine. Dr. Heinzelmann graduated from the U of A and from UAMS. I was also the team physician for Rogers Heritage High School. Dr. Heinzelmann, thanks for coming on Halftime today. How are you?
Yeah, I'm doing great. Glad to be here. Love you guys' show.
Appreciate that.
Every time I can get a break, I want to listen to it. So.
Good. Well, it's actually a pretty timely interview as far as Arkansas athletics are concerned because Jalen Catalon is out for the rest of the season with he's going to be undergoing surgery for his shoulder, and I don't know what exactly the situation is with his shoulder or what it is they've got to do with it, but you're an orthopedic surgeon who specializes in surgery on shoulders. And I've got a baseball background. From all that I know about injuries to the arm, the shoulder injuries are the ones that usually take a little bit longer to bounce back from the elbow injuries. Why is that?
Well, it's a dynamic joint, specifically the shoulder. There's a lot of mobility. Like the knee, it's like a hinge that goes front and back. But the shoulder, there's a lot of moving parts. You have a lot of range of motion. So kind of getting those things balanced is difficult sometimes and hard to, it takes some time to recover from that, especially with like an overhead thrower. It's just so much energy that's going into a pitching motion or a throwing motion for a quarterback or something like that it takes time. Yeah, definitely.
Yeah. I always read the natural motion for the shoulder is not to be throwing over the top of your head. It's more to throw it underneath the way a softball pitcher does or the way that a submariner will. And I guess that's the same, involving football, but nobody's really throwing it that way. I think when we're talking about injuries to joints, there's the different kinds of injuries. There's the impact injury in which the joint can just be hit really hard. And then there's, I don't know if overusage is the right idea, but repetitive motions of throwing can also get you. And for guys like me, and I'm 44, when you deal with pain in the shoulder, it's like this is the kind of thing that can stick around for quite a while. So for someone that's like 44 years old like me, what's more of the common injury that you can deal with shoulders that you got to watch out for?
It's common. When we get into the 40s and 50s, life kind of catches up with you a little bit. So you have a little bit more overuse. The tendon itself is getting older as you're aging. So that, like we'll say, rotator cuff injuries. So that's really the most common thing that I see in patients that come in that age group where, hey, I'm feeling pretty good. I like to get out and work out on the weekends, maybe play a little bit of pickup basketball or whatever it is. And my shoulder's been bothering me now for a few months. And it's usually something related to the rotator cuff tendon group in the shoulder. So that's probably the most common thing that I see, at the office in that population for sure.
Tell me what a common injury would be for somebody's knee as well. And I'm dealing with a right knee that's been sore for the last four months. So I'm willing to listen to anything right now because nothing I do is working. So what's more common for knee injuries?
Well, in the knee, same thing. Everything we always determine, how old's the patient and what are they doing. So in that age bracket, 40s, 50s, we start worrying about the meniscus, is a little soft tissue that's in between the knee bones. That can be an issue. You can also start developing, some people develop early arthritic changes in the knee. So, nagging injuries that don't get better, it may be, even if you've done the things that everybody would think about doing, ice, rest, some anti-inflammatories, if it persists, it may be worth getting an x-ray, getting an evaluation to see what's going on. And ultimately, for like a meniscus or something of that nature, those soft tissues, MRIs are often needed to fully diagnose it.
Mm-hmm. Doc, I'm also going to use you for some free medical advice.
Everybody does that with doctors,
exactly.
right?
I mean, I'm sure you've never been to a party and somebody goes, "Hey, can you check out this or that?" Like, sure. I'm sure it never happens. But I've had 2 labrum surgeries and an ACL. Okay. And first off, with the labrum, and it's not the doctor's fault. I, especially the second time, didn't rehab right, was kind of just over the whole thing. And to this day, I still have trouble keeping my arm above my head and trying to push things upward. What's something that I can do to kind of help that out? And then for the knee, I have problems that it like gets locked up and it feels like I've got to force the bone. It slides, as the knee to the leg bone, or there's more technical terms. So, like, what are some things that I can do to keep those things from happening?
Yeah. I mean, how old are you?
27.
Going on
your
48.
Surgeries were back in high school?
Yeah. Shoulder surgery, first one, freshman year, knee surgery, junior year, second shoulder surgery, senior year. So 3 and 4 years.
Yeah. I mean, in your shoulder, it's possible that you may still have a little bit of instability that's going on. I mean, labrums are often fixed for, dislocation events, especially in, like, say, a high school or collegiate football player. All those collisions, you can end up with a dislocation, tear your labrum. So rotator cuff maintenance exercises are the thing that would be the most important for you. The rotator cuff tendon and muscle groups around the shoulder help stabilize your shoulder dynamically. So the muscles are trying to help the labrum and the ligamentous structures keep you in the socket. So you may be a little out of balance. So when you're lifting over your head, you're trying to center the ball in the socket. Your body is, but if you have a really good toned up rotator cuff tendon, that'll help you with that. And that's something you can do. You can probably, you can YouTube rotator cuff maintenance exercises, strengthening exercises, and find some stuff there for sure. I mean, your knee, it was your ACL knee?
Yep, ACL.
Okay, yeah. I mean, it could be getting a little loose if you feel like you're having instability or shifting of the bones. It's possible that you have a little bit of laxity there, and you're pivoting when you walk. Kind of turns into a little bit of a trick knee, and it can, you got to work on quad strengthening. And if it continues to be an issue, it may be worth further evaluation for sure. If it's unstable, you can be kind of like a loose wheel on your car, it wears out faster, so you can develop meniscal tearing, and some arthritic changes possibly. So, a
couple more minutes here with Dr. Andrew Heinzelmann, who is from Ozark Orthopaedic, specializing in surgery of the shoulder and knee. Dr. Heinzelmann, there's a difference obviously between injuries and nagging pain, and for people that. Sure. Compete in any sort of athletic competition, or just working out, or just going for runs, you know that you're going to feel sore, but sometimes in the back of your head, you're a little nervous that maybe you did something to the shoulder or the knee. So how do you, when people feel pain in those areas and it's nagging pain, what's the best way to, attack that pain so that you get the proper treatment you need?
Right. I mean, initially it'll be, okay, what's causing it? So if I'm running and my knee starts to hurt, maybe I do a cessation from running and start doing some more biking and ellipticals and things like that. If it becomes, and maybe do a little bit of strengthening, physical therapy, anti-inflammatories, but if it becomes a persistent problem and all of a sudden you're not doing anything anymore because everything that you try to do becomes symptomatic, that's usually the time it should be evaluated. Kind of come into the office and see what's going on. If it's something that can be fixed with physical therapy, rehab would help, or other modalities, injections, things like that. Is it something that we're concerned about, a potential surgical problem, and look that up. So definitely give yourself some time and rest and think about what was causing the pain. Hey, I went out and I played softball and I went real hard the past month and now my shoulder hurts. Well, if you rest, that may go away, and do a little, kind of get away from that activity for a little while. So,
well, and
things that are going on for, 6 weeks, 3 months, and you've done a lot of the rest, probably worth getting it evaluated, on those nagging things, that you don't have a specific traumatic event,
let's not keep popping Advil. Let's get that thing treated the proper way. And there are, you guys have, Ozark Orthopaedics has plenty of specialists and clinic locations around the area to take care of folks. So, I mean, any sort of joint pain, I'm sure Ozark Orthopaedics has somebody that can deal with it. You specialize in the shoulder and the knee, but you got plenty of other orthopedic surgeons that specialize in other areas.
Right, correct. Yeah, we got it covered. I mean, we have, spine specialists, hip and knee specialists, hip and knee arthritis specialists, foot and ankle, hand and upper extremity, so hands and elbows, shoulders. So we even have non-operative kind of spine care specialists as well, physical therapy. In addition to that, we have an injury clinic that's open Monday through Thursday, 4 p.m. to 8 p.m. And it's just a walk-in. So, you say you're riding your bicycle and fall, and, man, I think I maybe broke my collarbone or injured my shoulder. I feel like I need an x-ray, but I don't want to go to the emergency department because I don't think it's that bad. That's a good place to go because we can get it x-rayed, get looked at, and kind of get the ball rolling on some treatment. So,
Dr. Heinzelmann, appreciate you hopping on with us, and thanks for all you do. And hopefully this conversation gets some people that are dealing with some pain right now in those specific areas to maybe seek out Ozark Orthopaedics to fix it up. Thanks for your time.
Absolutely. Thank you.
Thanks, Doctor.
And our listeners can visit ozark-ortho.com for more information, all the clinic locations, all of their specialists, and anything else you need dealing with orthopedics, ozark-ortho.com. All right, we'll wrap halftime up after the break with 3 Up, 3 Down.